Thielebeule from the University of Cologne in Germany, where I work as the director and chair of the Translational Research and Clinical Trials Center. And what I do clinically is the infectious disease consulting work at the university hospital. We do have, together with the university and the university hospital, a European Mycology Excellence Center by the ECMM designation. And today's program is on the European Quality Scores for Infectious Diseases. Guidelines have been issued for many diseases, maybe for most diseases, but there are always, with every single guideline, two key questions remaining. Are they being followed? And does adherence to the guideline improve patient outcome? Both questions we cannot answer without a tool that measures guideline adherence. So that's the reason why we created these equal scores together with the European Confederation of Medical Mycology, the ECMM, and we issued them in many different languages. And I'd like to lead you through the equal Aspergillosis score or Aspergillosis score. It is primarily aiming at patients in the hematology or immunocompromised setting where we see most of the invasive Aspergillus diseases. The equal Aspergillus score is split into three parts. It's diagnosis, treatment, and follow-up. And I'd like to quickly lead you through. It's relatively complex because it has around about 20 different recommendations that we should follow according to the guidelines. So, for example, it starts with a prophylactic setting. So any neutropenic patient who is so for more than 10 days or undergoes allogeneic stem cell transplant with or without neutropenia would be as immune suppressed or sufficiently immune suppressed to be at high risk, and there should mold-active prophylaxis be given or a galactomannan screening be done 2 or 3 times per week. All this is A1 recommendations, and it earns you 3 equal score points because that is what you get for an A1 that you follow. If there is a persistent fever, a CT scan should be done, and then you can see that it just follows the chronology. If on that CT scan you find a lung infiltrate, the patient would be eligible and should undergo a bronchoalveolar lavage, a BAL, with the tests listed here that should be done on the BAL fluid. And the next step, or maybe in parallel because it's another step to be done on that BAL sample, is Aspergillus should go in culture, and if it grows then you can go for identification to species level. I guess that's really important. And you should go for susceptibility testing. However, the guidelines are not super strict with that, and it only therefore earns you 1 point each if you follow that. In refractory cases, you should go for histology. Now, there is quite some uncertainty on exactly the stains you should use. I mean, if you use them, then go for this 3 or the 2 stains and the molecular diagnostics if your center is capable of doing that. However, the evidence is not so strong that we in the guidelines would find a 1 recommendation for that. So it's a weaker recommendation. It gives you 1 point each. With that, diagnostics is complete, and we continue with the next chapter, so to say, somewhat further down in the score or scoring card. And there are 2 recommendations on treatment. And that is on first-line treatment, and that is isavuconazole or voriconazole, or if the patient was on one of these drugs for mold prophylaxis, for example, POSA or one of the other 2, then one wouldn't want to treat with a nasal. One would change class, go for liposomal ampho, or in rare circumstances for caspofungin if, for example, renal compromise would prevent you from going with liposomal in adequate dose. And if there is no risk at your site for mucormycosis, that would be another prerequisite. That's the thinking behind the behind these treatment factors on the score, and doing so would earn you 5 points. And if you go for voriconazole but don't do TDM, then you would actually lose a point, because that would be -1 for that, because voriconazole, according to the score, comes with TDM in any case. During the follow-up period, that's relatively easy, and you already might have realized that we focus on the most often affected organ, which is the lung in these patients. So it says CT scan and practically means thoracic CT scan, and that should be done on day 7, on 14, and 21 or 28, maybe even on both days. And one could consider going for a low-dose CT scan if there is a ability to do so at the radiology that you use. All that has been published in a paper in Mycosis last year, which I led the team of authors for. And so let's summarize what the score gets you, and that is in terms of the achievable maximum number of score points. You can mostly see 3 different populations here, and that is for those patients who do have a positive culture of Aspergillus growing. Then you can earn more diagnostic score points, because you can do, as said, the additional tests on the pathogen that you cultured. If there is refractory disease, there is another diagnostic point to be earned, and if culture is positive and refractory disease, yes, that's the maximum of 15 then, and that is only for the diagnosis. Treatment and follow-up are pretty identical for all these scenarios. That is why there is only the numbers of points given on the slide, and then you can add these 3 lines up, and that brings you to the total number in the maximum score, the maximum number, which might range from 22 to 27 depending on the setting of your individual specific patient, and specifically depending on whether there was a pathogen to isolate it that you could work on microbiologically, do susceptibility, etc. We amalgamated the information from that Aspergillus score into a pocket-sized card, which can be downloaded from that QR code given on the slide, and can easily be carried around and might help you with your hematology patients with Aspergillosis to rule in or rule out the disease, and if you rule it in, how to properly manage it along the guidelines. So how can we use the equal scores, the European Quality of Management in Infectious Diseases scores? We can weigh and aggregate recommendations with these scores, and they display what would be an ideal disease management. So the scorecards hopefully are a useful tool for measuring guideline adherence, for antifungal stewardship, and to facilitate clinical decision making, because if this is a pocket card, then you can always easily have a look and see what additional diagnostic or treatment steps should be taken next. The equal scores provide an easy to follow algorithm, and they are in different languages. And for the moment, that is Albanian, English, French, German, Greek, Hungarian, Italian, Kurdish, Polish, Portuguese, Romanian, Russian, Serbo-Croatian, Spanish, and Turkish. But there are more translations to follow. And if there are any languages that you would want us to translate this to, let us know. Thanks a lot. Have a good day.